Hi, good afternoon. I'm so sorry for starting the webinar late. We were experiencing some technical difficulties, so in the interest of time, I'm just going to jump right into it. For our first webinar, we have Smiti Garhotra from class 14, and she will be speaking about mental health. And I will just give you a very brief intro of Smiti, so that and then hand it over to her. Smiti has a master's degree in social work from Tata Institute from Mumbai, India, and she's currently serving at Nike Foundation in Portland, Oregon, as an Atlas Core Fellow. Smiti, over to you.
Hi everyone. Sorry for the delay. Okay, I think there was some confusion. Sorry about that, guys. Okay, so why mental health? Mental health is a societal issue today because of the negative stigma attached to it by the general public. There is lack of awareness, and most of us have such problems. However, we don't see it as an issue. Mental health does not only affect an individual suffering from mental illness, it affects all the people surrounding that. Why is, what are the topics I'm planning to cover in this presentation? I'm planning to cover why mental illness, what is depression, relationship between youth and depression, and suicides, and question answers. So why did I choose this topic in the first place? October being the World Mental Health Awareness Month and October 10th being the World Mental Health Day, I thought it was a good topic to share with everyone. Now, going forward, as I've already discussed, why mental illness? Mental illness is a societal issue which impacts everyone around us, but it is seen as a weakness in most of the developing countries, hence we do not see it as an illness. Why is it a societal issue? Because of the concurrent diagnosis and increase in suicide rates and increase in homelessness. So there are around 70% of people who attempted suicide so far are suffering from mental illness. What is depression and why depression? Depression, it is found to be one of the most prevalent diagnoses in mental illness. So the most common form of mental illness is depression. And as the statistics indicate, globally there are more than 350 million people of all ages that suffer from depression. Depression is the leading cause of disability worldwide and a major contributor to the global burden of mental illness. What is depression? According to WHO, depression is a mental health disorder characterized by sadness, loss of interest or pleasure in life, feeling of guilt or low self-worth, disturbed sleep appetites, feeling tiredness, and poor concentration. So basically, in simple terms, if you have a feeling of giving up everything in life and just dying, is what depression is, basically. Depression can be long-lasting. It can impair an individual's ability to small chores. Two types: unipolar and bipolar mood disorder. In unipolar, once the depression onsets, it is the same low feeling throughout at a constant pace, and it does not go. In bipolar, you have basically two phases, a high or a mania phase where you require minimum sleep, and you can work with 1 hour of sleep and you're the most productive in this phase. Low depressive phase, is where, like the unipolar depression, you do not feel like even getting out of bed. So just to share an example, how does a person see a small chore of making salad in depressive phase? So when I explain, before I go ahead with the example, if anyone has any questions, I would request you to write it in chatter and I would answer those at the end of the presentation. Okay, going back to the example, a simple chore of making salad. How does a person with depression see it? Open the fridge, choose on what vegetables you need, what fruits you need for the salad, take out one by one each fruit, wash each fruit, put the fruit in a basket, choose the knife which you need to cut the fruit from, look for the chopping board, take out the chopping board, put the chopping board on the table, take each fruit one by one, cut each fruit, put all of this in the bowl, then choose the dressing. So this simple task of making a salad becomes a tedious task for them because they see each step as a giant leap. Hence, it is a very serious illness. I'm going to be talking about focusing on depression and youth. When I'm talking about youth, I'm talking about teenagers starting from age 13 to 25 years. So I'm going to be using the terms interchangeably, teenagers and youth. Why I chose to focus on youth was because most of us in the field work with youth, and youth being the new generation which is going to be taking forward to a lot of tasks, I thought it was essential for us to focus on the earlier phase and then help prevent the illness from going further. Youth experience depression in a manner very similar to adults, but their experience of emotions are more intense and of a greater intensity. Now, how is it different from anyone feeling low for an upcoming exam or having a breakup from a relationship? Most of us are able to bounce back upon in a certain period of time, not immediately, maybe in a week's time. However, a person suffering from undiagnosed depression is never able to bounce back up and go do the daily chores or become upbeat again. Youth with depression is a serious issue. However, it is curable. Most of the depression cases are curable, and hence we are looking at this illness. Now, teens or youth under stress experience loss or have been facing anxiety disorders are at a higher risk of depression, especially girls. They are at a higher risk because of the minority in the youth. Now, what are some of the symptoms if you want to understand depression? And this will help you even understand depression for diagnosing an undiagnosed depression, or you will be able to identify people around you which you see some symptoms in and you think you can help. Most of us can help with the mild cases of depression so that it does not lead to moderate or severe. Moderate and severe, however, require a formal source of treatment and medication. So what are some of the symptoms? The easy way to remember these symptoms is by remembering the term sigh escapes. S standing for sad mood. So you feel sad every day throughout the day and you want to cry throughout the day for no apparent reason. I standing for interest. You have a loss of interest in almost all activities. So the activities you liked doing earlier, maybe going for walks or even talking to friends on phone, you no longer have any interest in any of those activities. G standing for guilt feeling. You have excessive feeling of guilt nearly every day for family suffering family because of me. So all that guilt feeling comes out. H standing for hopelessness or helplessness. The feeling of hopelessness and helplessness comes out of traumatized self-esteem. So your self-esteem is also reduced. S stands for performance. It can be school or work performance. Your performance deteriorates at school or at work or at home. Escape. E stands for energy loss. You're always at a low energy level. S stands for sleep disturbances, inability to sleep for long hours. Even if you are in bed, you are not able to sleep. C stands for concentration deterioration. So you are not able to concentrate on any task. A standing for appetite loss. You want to give up your life. You see no reason in living, hence your appetite also reduces. P stands for pleasure loss. Day after day, there's nothing that instills pleasure into you. There's no motivation. E standing for emotional isolation. Most of the people suffering from undiagnosed depression will try and isolate themselves and stay alone. And S being the most serious one, suicidal attempt, which is a moderate or a severe form of depression. So if you identify 5 or more of any of these symptoms which I've just told you about for a period of more than 2 weeks at a very high intense level, then these patients need help and they need to be diagnosed properly. So what causes depression? Now, depression can be caused because of biological changes that happen at puberty or which happened at a later phase of life. The work pressures or study pressures, like most of the developing countries, for example, like India, focuses intensely on studies. And if you do not perform, and if you're not a high-ranking performer, you're not considered worthy for anything. So hence, these kind of pressures also push you to the limit and you start becoming depressed. Environmental changes, you relocated to a new location, you're not able to adjust to the weather, to the new routine, to the new structure. Sometimes chemical imbalances or genetical dispositions, that is, most of the studies done on depression in developed countries have showcased that if someone in your family is suffering from depression, there are high chances of you suffering from depression or an individual suffering from depression. Stressful events like deaths in the family of someone close to you. So if you see in the image on the screen, a depressed brain, there is no activity in the brain whatsoever, hence it's all blue. But when you start taking treatment and you start regaining life, or you start thinking about life, you start having brain activity all over again, which is the yellow points highlighted. Now, how is suicide fit into depression as a whole? I told you about the statistics of people being depressed, 350,000, out of which 50% did try and attempt suicide. So how is suicide relevant? Suicide results to an estimate of 1 million deaths every year. And youth suffering from depression are 12 times more likely to attempt suicide. Of course, like I already told you earlier, suicide not only impacts the individual, but also people around the individual. Now, how is suicide relevant? A deliberate, unexpected, and aggressive way of dying in youth always makes others feel discarded and weak. A family member or a friend has the additional burden of finding the victim's body. Friends or family members often go through an inflated feeling of disgrace, guilt, or responsibility of the person who's committed suicide. Now, in this whole picture, let's try and connect it to one of the live current scenarios, which is homelessness. There's a study which was conducted in Canada which showcased that youth make up the fastest growing population with homeless population, especially with poor mental health such as depression. The study was conducted for over 150,000 staying out of home on streets, and 50% of them were suffering from depression or a drug addiction. Now, how does all of this homelessness play a role into the societal health we are talking about in mental health? Homelessness leaves the affected youth with no permanent address, making it impossible for them to attain education or employment, even secure food or survive for shelter or for surviving shelter. Now, this vicious circle, which you see that they are not able to gain education, employment, not able to earn for food and shelter, leads them back uh, and pushing them further to a vulnerable position of drug use or depression or unsafe sex, and this increases other health issues. So this all actually interbinds into the big societal health issue of mental health. Now, what are some of the barriers to the treatment? We have discussed about it being a stigma to the society. So if this is seen as a stigma and if it is seen as a weakness in your society, you would not like to have anyone finding out about it. Hence, you would not even go to the hospital. How would the people think in the psych ward or judge you? Now, concerns about confidentiality. Now, most often, if it is a youth, they do not want their caregivers or their partners to find out that they are suffering from any kind of mental illness. Lack of awareness, and of course, the financial burden. This brings me to an important aspect. We, as workers in the field, what can we do and how can it be managed? Depression is easy to manage. The four things which actually help in managing depression is a lot of exercise, a rigorous regime to be followed, a healthy diet, enough sleep, and time for social life. Even if you do not feel like having a social life, you need to force yourself to create time for social life. Apart from this, what can we do? Now, communication is pivotal to help patients and clients for self-worth and often view themselves as hopeless. So you as an individual with play a greater role of allowing the person who's feeling low to communicate their feelings to you in a non-judging manner. Ensuring that the person does not feel alone and encouraging that the person is not the only one who's suffering from this kind of an illness and can come out of it. Encouraging the person suffering from mental illness on the instances when they were at their higher capacity and relating them to a personal experience. For example, when I was working with one of the individuals back home, that individual was one of my encouragements of doing something in my life which made a lot of difference in my life. I was able to encourage that person back by replaying that story and how that person helped me. That's another way of cheering up, of helping the person cope up with the situation. Avoid saying words like cheer up or you'll get over it. Now, depression is not a choice. And saying things like this will not help you transform the situation. An individual, irrespective of what age or who the individual is, has a right to feel emotions and whatever they might feel. So please avoid saying things like cheer up, it is no big deal, you will just get over it. Apart from this, what are the other things at the broader context you can do? We can ensure that individuals learn to help themselves, because this is a long-term illness. It is essential for us to capacitate the individuals suffering from the illness to help themselves. And cognitive behavioral therapy can play a very important role in this, which play an important role, but this needs help from experts. So cognitive behavioral therapy cannot be done at home. You would need additional resources and help. Raising awareness about the mental health issue through social media and public education, advocating for changes in the policy with focus on mental health in your government structures, targeting one-on-one communications with people you come across to reduce the stigma, and requesting your raising awareness to for budget allocation for general public and political and to help generate political will to direct resources for mental health programs. So overall, just to sum it up, that mental health is equally essential as public health and other forms of health provided. Depression is the most common form of illness, but it is one of the forms of illness which is 100% curable and treatable. We can play a very important role in reducing the stigma it as we work in the field and can play an essential role into it. I hope this clarifies some areas of mental health and depression. I would be open to questions if anyone has any.
Smiti, let me just jump in real quickly. We have, I think we have like 3 to 4 more minutes. So if you can sort of address all the questions right now, like take them all at once, that would be great. Just read them out and just.
Yunus, I can't see the questions.
Some of the questions are posted in the Q&A tab. If you click on the left, you will be able to see them on your screen.
The Q&A tab, I can't see them, Yunus. If you can read out the questions to me, I will try and address them.
Sure. We have. Right. So we have a question from Darren, and he's asking if you can elaborate on how it is a useful subject for the fellow community. Oh, that's me. So yeah, I asked how can you sort of also summarize by telling how the fellows can benefit from the information that you've presented, and how it is of value to them in their daily lives and also during the fellowship. And I think this is something that's also come up recently as well, as some of the fellows sort of exhibited signs of depression and sort of earlier symptoms as well, from what I've heard. So this is a good segue into that. And then I think Meda asked, in terms of severity, where does depression lie in the spectrum of mental health problems? Michael asked, what is the difference between mental health that leads to suicide and that leads to someone to go alone on the streets? And then Darren asked, is there any statistic that what is the percentage of the youths youth who have depression with this? I'm not really sure if I understand the question, but this was a question. And Prem asked, can you provide some of the examples of constructive activities one can be engaged in so she can reduce depression or mitigate it?
Okay, I will try and address to all the questions quickly. The question regarding how is it useful for the fellow community, most of us when working in the field, this is something which we often ignore, that the person might be feeling low for a long phase of time, and we just overlook this because of how we are built in the society and how we grow up in the society. It is often which leads to serious issues like suicide later. So so if you keep in mind those symptoms and the sign escape formula which I gave you, it will help you see if the person really needs your help. Even it helps you identify within your family and your friend circle if someone is suffering from depression, because it is 100% treatable. Now, the WHO statistics, which I'm not very confident about, however, says that more than 20% of the youth in Afghanistan face depression as a disorder, and whereas in comparison to Japan, only less than 2.5%. Why I'm not very apt about these statistics is because in Japan, in most of the Asian countries, a sign of weakness you would not go to seek facility for. So hence they are unreported cases, and what the statistics show are only the reported cases. So I think the figures might vary. How is mental health that leads to suicide was something which was asked, if I'm not wrong. So if any form of mental illness is untreated for a long period of time, it will lead distress in the individual, and the individual might go up taking severe forms of ending their life. And when we're talking about someone being alone on the streets, the person alone on the streets might suffer from depression or might suffer from another form of illness of hallucinations, like schizophrenia. If you want to understand how a person lives his life with depression or what they can do to help, I would advise you all to refer to this book, Shadows in the Sun, Healing from Depression by Gayatri Ram Prasad. This will be one of the resources which I'll be sending out to Eunice to share with the fellow community on how a person's life and the family and the life around him or her impacts from someone suffering from depression. There was another question. Okay, someone asked how, if someone is suffering from depression, what can you do? Be a friend, be non-judgmental, encourage the person without really telling the person to cheer up or get over it. Helping the person explain his or her emotions, because it is easy for the person to vent out his or her emotions. Encouraging the person, taking back from the personal relationship you have with the person, or in senses where the person did make an impact in some sense in your life or in the life of others, which was significant. Does this answer all the questions, or have I left any question?
Smiti, I'll just quickly jump in. I think we're out of time, so if there are any further questions for Smiti, I would invite fellows to email her or post questions on this thread on the webinar page, and then please fill out your surveys that I sent out yesterday to give us feedback on how the webinars went. And I think that's it on time. Thank you so much, Smiti, for taking out time and preparing this presentation for the fellow community.
Yeah, I'll be sharing out the statistics and resources with everyone.
Okay, so I'll with the fellows as well. All right, cool. Thank you so much.
Thank you.
Bye.
Bye.